What we know is that maybe as high as 70% experience a co-occurring mental health issue. And so increasingly, we were also getting calls from adults who were trying to untangle their diagnosis. And we were getting calls from schools saying, we think we understand autism, but these children who are coming to us who also have co-occurring mental health issues, those are the kids that we're struggling with. So the dual diagnosis can be a cognitive disability, mental retardation, a learning disability, ADHD, obsessive compulsive disorder, anxiety disorder, the entire list, kids with bipolar. And again, I've been working with some kids who have 5 and 6 different diagnostic labels. So these children, we were really having a difficult time finding options for them and finding services and expertise that could really support them. So this has kind of landed me into the land to think about educational neuroscience. And we have been very blessed to have people in our state who are really leading the charge on that. Lori Desital, if you haven't heard of her, really brilliant around educational neuroscience. And so we really have been helping kids and teachers and professionals understand how the brain works and how that impacts behavior as well. And so there's some research-based principles that we know. One, we know that movement enhances learning and memory. And so exercise has been shown to be a very strongly correlated with increases in brain mass and production. We also know that emotions can have a great impact on learning and that students cannot focus on the curriculum unless they feel physically safe and emotionally secure. And in some of our schools, our superintendents are saying the first thing we have to attend to is the social emotional health of our students. And if they are socially emotionally healthy, then they can learn better. We also know that the varying pace of brain development helps to explain the behavior of children and adolescents. So the reality of it is that we know that the brain is actually not very fully developed until a child is around 24 years of age, which to me, being on a campus of 48,000 students, helps me understand a lot of what goes on our campus. We also know that a school's social and cultural climate affects learning. So if the culture is characterized by openness, where there's clear levels of expectation, where there's an appreciation for effort, where educators feel valued, that is going to be a better environment for students. And we also know that the brain continues to grow new neurons. So neuroplasticity is an issue for our folks.